major manufacturers about their potential production capacities. What we're interested in particular with Sinopharm is what they may be able to do beyond China to help with the global response. And there's been a lot of work by the company over the last months having to help serve China's population, which of course is huge and will make a substantial demand.
So what do we know about the WHO assessment process that is going on at the moment? What do they want to know before they sign this vaccine off?
Well, that's a great question. So, fundamentally, they're trying to answer essentially two questions that we all want to know the answer to as well. And I think this is where they start. First, is the vaccine safe? In other words, are there no untoward or significant untoward side effects from the vaccine? So that's first. And the second is it effective? And they have a reasonable threshold that they're using, similar to what the American CDC uses, which is about a 50% efficacy rate or better. And that's what they're looking at. And if we think about the annual flu vaccine, that's roughly the efficacy rate that the flu vaccine has currently. So this is what they're looking for when they begin to analyze or go through the data that the working group has been looking at now for a number of weeks as they make a decision as to whether or not to certify the vaccine.
Some of the questions that we are getting in, Dr. Howard, people are asking why we're only seeing Sinopharm being signed off now, when it was one of the first vaccines out of the gate, so to speak, but not one of the first to get the emergency approval from the WHO.
That's an excellent question, and it comes down to the fact that Sinopharm delayed or just waited to turn in their data to the World Health Organization for consideration later than some of the other vaccines currently available throughout the world.
What does it all mean in practice for the UAE? What would a yes or a no mean for the vaccination program going forward here?
Well, I think that a yes, and taking a more optimistic point of view, I think a yes means several things. It gives us additional confidence that the vaccine that has been used here in the UAE gets another stamp of approval, if you will, in terms of safety and efficacy. But I think beyond that, what it also allows for us is probably more security and safety in traveling. Because if the WHO does sign off on the vaccine, then other countries will certainly follow suit, recognize it, and give more credence to the vaccine for individuals who have had it, and begin to give more security, especially in international